Hello, my name's James and I work for the Quality and Compliance team and I'm the new chair of the LGBTQ network.
Hi, I'm Paul and I'm part of the Sexual Health Service and I'm the co-chair, vice-chair of the LGBTQ Network Forum.
Hi, I'm Claire Garrett, Inclusion Health Officer for CHCP in Primary Care, and I am part of the LGBTQ+ group.
So I think for me the most important thing we do in the Network Forum is peer support. I think it's always handy, you know, when you might be experiencing something at work and you think, am I overreacting or would somebody else feel like that? And just to talk to your peers as well as your allies, just to say, you know, am I overreacting? Is it something I should be thinking? We also aim to promote the group across the service. That's one of our major targets this year, just to increase engagement and to just be more inclusive in the whole service, really. Some things that I'm particularly proud of that we've done, we did a sponsored walk where we raised money for a local LGBTQ charity. We put together a training package as part of a wider team, and that was just looking at more inclusive terminology or the history of LGBTQ and moving forward, what do we want to achieve with this training package. Every year we represent CHCP at Hull Pride, which is always one of my favourite days, mostly because it's fun. You know, it's a good way for you to meet everyone else in the team, in the group, but also on a wider scale you get to see people that aren't even members of the team but are still supportive of the LGBTQ network. So that's really good. We march in the parade, we promote our services. So yeah, that's probably my favourite part of the group, is representing at Hull Pride. But then each individual service as well also represents at other prides, like Bridlington Pride, Wolds Pride, Beverley Pride. So that is something that we are looking to expand to in the future. The forms, making them more inclusive, gender neutral, using pronouns.
We've done the toilets, so we gender neutralised all the toilets.
Yeah, across the whole of CHCP.
Yeah. We've seen Dr. Finlay retire as part of our director for the network group, and we've now seen Sue Baker take that appointership for our group. Yeah,
I think one of the best things we've achieved is getting guest speakers to the group.
Yeah, Carl Osler, wasn't it?
Yeah, we had a member from Humberside Police talk about hate crime, which I think everyone took something away from. Especially, you know, for me as somebody of that community, it was interesting because it really gave me a perspective of things that, well, actually, I've never thought of that. I think another thing that we've all done is we've been part of like the Freddie inclusive events. So we went to a microaggression, which was where all the band 7s and above within the service met and we discussed microaggressions. And it gave us a chance as the group to talk about our own personal experiences and really made management think, oh, well, actually, I didn't realise, you know,
how comments can affect.
Yeah, and I think that was important because I think sometimes that flippant comment, how ever innocent it can be, you know, sometimes there can be a hidden meaning to it, or somebody can take something away from that maybe wasn't intentional, but it just forced people to think of it more.
Absolutely.
And it still makes that person feel bad, don't they?
Yeah. So I think we've achieved a lot, really.
Definitely.
Yeah. I look forward to achieving a lot more.
Definitely.
What we've done is we used to meet monthly, but we found like the timing was, obviously we've all got other commitments within our roles, and an hour maybe wasn't long enough, so what we've done is we've condensed it into a 2-hour meeting, but quarterly. So the next meeting is going to be all about Hull Pride, hopefully. So we meet in July, don't we?
Yeah.
We do.
And yes, it's going to be Hull Pride in July, so there'll be lots of talk about getting ready for that, getting ready for the parade, what we can achieve, what we can promote, and as always, just promoting engagement. I think that's going to be.
And showing that CHCP are inclusive. And showing that we try to break down barriers within healthcare.
We are going to be continue welcoming guest speakers. I know we're keen to work with other network forums across the Hull and East Riding area. So, for example, Hull University. So we might invite other chairs from guest speakers to discuss about obstacles they face, things they've achieved, and just see how we can work together as network forums to achieve bigger, better things on a wider scale within the community.
My favourite moment from this group is learning. I feel like I learn so much and I'm able to take that back to both patients and staff in my role, I look after patients, but I also am a manager. So I feel like I can take that learning opportunity back and also break down barriers within primary care.
And for me, it's meeting new people as well in different services across the CHCP, and like how Paula said about learning about the community more as well. So.
I think mine would probably be that extra level of support. You know, something that you don't maybe necessarily have in any other job, without a network forum. But as well, yeah, I've got to admit I do enjoy the social side of things within, like, going to the whole Pride and the networking that comes with it by going to meetings and representing the group, and just that sense of achievement when you actually do make a positive change and to make the company more inclusive.
I think for the peer support as well, Paul, you've done fantastic in that. You are very much an advocate for peer support with no judgment. So whoever brings something to the group, you're able to give that non-judgmental approach. It's about showing that you can break down barriers. Learning, it's a great learning opportunity. So for myself as an ally of the group, I have learned so much from the actual community. So I think as well, it is as well as breaking down barriers and learning those things, you can take them back to your services, but also learning for your own learning.
Yeah.
And it's a safe space as well for people to come along to talk about anything that they want to as well.
Mm-hmm.
And then for me, it's that peer support.
Yeah.
It's meeting people like you in the company, sharing experiences,
Yes.
just getting that support from somebody, whether you need it or whether you just want to actually talk about something good that's happened within your service, and then you can take that. And so for example, something good might happen in my service that you to go, oh, actually, that's something we can implement in ours.
Yeah.